So this is the disconnection happened because of Instagram. There is 1 hour is the limit.
Yeah,
Sorry,
I
what
think I'm
happened?
1 hour. It's exactly the Instagram. So this one 1 hour. So
Okay.
59 minutes it gets disconnected.
Okay,
So
okay, okay. Fine.
yeah.
I was
I'll
just
just
going to
check
ask,
it.
are there other questions that
Yes,
you've
ma'am.
come
We have
across?
got
Yeah,
questions.
yeah,
Yes. We have got 2, 3 questions. Let's wait for ma'am to join.
yeah. So I didn't realize it was like Skype or well,
Yeah, it
that's
is there, ma'am. 1 hour it gets disconnected. So people have joined back. So I'm just checking if ma'am has joined. So the question is for you, ma'am. We'll wait for ma'am to join till the time I can share the question with you. The
yeah.
question is, will the patient become a diabetic if the acanthosis is not treated?
Absolutely. Well, I mean, I wouldn't say 100%, but definitely a lot of people with insulin resistance do go on to develop diabetes. But like I was explaining at the start of the talk, it's not only the diabetes that we're concerned about. Insulin resistance is associated with a multiple other problems like high cholesterol, fatty liver, irregular periods, difficulty getting pregnant, hypertension. So multiple things. In fact, there are now recent data saying that insulin resistance is one of the reasons for developing other chronic diseases like depression, dementia. So insulin resistance is associated with a number of medical conditions. Diabetes is one of them. But yes, it is one of, I'm not saying that 100 people, if you take with acanthosis, I would say at least 90 to 95% of them will have a risk of developing diabetes. Something that we need to be aware of and keep track. And the reason I brought up the thing about the psychological distress women is because I just wanted to tell people, please reach out. I think Dr. Parul has joined.
I'll
She's just
just check
joined.
now. Yeah.
Yeah. I don't know if she sent a request. So I just wanted to say that, like Dr. Parul was saying, there is help available, definitely. And, you don't need to be traumatized or get upset about, please reach out, to doctors like Dr. Parul who are well versed in treating this, and you don't need to suffer at all. Particularly, if a lot of times this is not addressed, this is not spoken about because they feel there is no help. And like you said, they go and try all this. I know of cases where they actually put, that Vim, the cleaning agent, and they try to scrub.
Yes.
Yeah, so, it's just very sad. And internally, if we take care of it, it helps a lot in controlling.
Dr.
Yes.
Jayashree, how early should we be really looking at improvement? I mean, if we have backed up with the right medicines and medications and diagnosed and identified whatever is behind, so how early should we be seeing, and what would be the journey, say maybe in 1 year or so?
So typically by about 3 months, you'll definitely start seeing an improvement. And it's usually, the other people around you who are going to notice the improvement. So it's usually the mothers, who are keeping the eagle eye on their children.
Yeah,
They
I
are
know.
the ones who notice the improvement initially. I think the full, and just to point out that even in this 10-year-old girl that I had seen with significant acanthosis, after discussing and understanding that metformin was an off-label indication in that girl, no sugars were absolutely normal, I did go ahead and get her started on it. And she stayed on it for 3 years, so till she was 13. And the acanthosis vanished, apart from lifestyle changes. She did a lot of exercise. And for her, what I did was I started off with exercise and diet. So I don't want, people to think that medications are the magic answer. Definitely, I give exercise and diet and weight reduction a good try, at least for about 6 months, along with, whatever the, like other supplements, alpha lipoic acid and the other skin lightening. If at the end of 6 months, we're not achieving good results, then I go ahead and start them on insulin sensitizers. But improvement, at least with diet and exercise itself, we can start seeing within about 3 months. So I typically have them come back within 2 to 3 months. But the whole course for it to completely resolve, depending on the severity, easily anywhere from 1 to 3 years is what I have seen. I'm sure you're a better judge of that, but I have seen it takes time.
Yeah, it takes time. So metformin, you would want to wait and then begin if in case the biochemically they are really not having the elevated
Exactly. So let's say they don't have the biochemical evidence of blood sugars or insulin resistance. Just for weight reduction, I generally do not start off with metformin immediately. I would wait at least for about 3 months, mainly because it's really an off-label indication. It is not recommended just for weight reduction. It is only recommended for, say, pre-diabetes or, PCOS in certain situations, though we all use it commonly. And also, I don't want them to think, so there will be a tendency sometimes, I'm not saying all the times, sometimes that you may exercise or concentrate on your diet a bit less if you put them on a medication.
yeah.
So that is the only reason, no particular reason. So I generally wait for about 3 to 6 months with a good try at diet and exercise before I consider using metformin, particularly in very young children without sugars or anything.
So I think you feel alpha lipoic acid would be a much safer and a much conservative approach along with the lifestyles to begin with for younger children as well.
Absolutely. Yes. Totally. Yes.
Now we have one more question. Does eczema after treatment, the patch is like acanthosis?
Yeah, so many kind of eczemas. So mostly the atopic eczema, which asthma. Actually, they will have from childhood a lot of elevations and these exaggerations of eczemas coming under the eye, cheek, sometimes on the side of the neck as well and other parts, along with the dryness. So dryness is a part of atopic eczema. So they will have a history of it, and anything which is repeatedly inflamed and eczematized will always heal with a pigmented patch. But they never look like Acanthosis nigricans.
Okay.
I mean, they are quite dark and pigmented and they're dry, but how acanthosis is actually elevated, rippled, and you can see, there are no cuts and all. There's no redness in acanthosis. While in any eczema patch, you'll always have an inflammatory, picture along with it, and there'll be history of exaggeration, remission, history of wheezing, sneezing, family history of asthma. So that is where your eczemas come into picture.
Okay.
That's why we have you, Dr. Parul. for non-dermatologists, everything looks the same. I can tell you that.
Ma'am, there is one more question. How to manage acanthosis post-pregnancy?
In pregnancy, as it is, a woman puts on weight, and also the hormones are all on the upsurge. So I think with all those, as it is, pigmentation will happen. The commonest one which we see is melasma. I think 80% of the Indian women being, skin type 4 and being in tropical country, we will have melasma post-pregnancy, little bit or the other. Few people you have overseen once. And also existing pigmentary patches, you may develop more of freckles or pigmentation which is never there because of the hormones you will tend to get. But what I've seen is post-pregnancy, after 6 months, they do, once the hormones fall down to the normal levels, those pigmentations also reduce, and they would maybe not come back to completely zero level, but yeah, they do reduce after you stop feeding, and once your prolactin levels go down and your other hormones come back to the base levels, the pigmentation does reduce.
So I just wanted to also add that pregnancy is also a state of insulin resistance. All of the pregnancy hormones prevent the insulin from working. So that's probably one more reason why a lot of the women develop acanthosis for sure. And the same advice that we've been talking about, exercise and weight reduction, particularly when you're breastfeeding, will also help in getting helping to get the acanthosis down.
And how about then in pregnancy? I mean, like you said, of course, to be more mobile if possible in pregnancy, that also would kind of help.
Yes. So to some extent, when we get the insulin to work normally so that your body is not making that much of insulin, it does help. And exercise is one of the key. Obviously, in pregnancy, we don't want them to not gain weight or to lose weight. But avoiding excessive weight gain by being on a good diet right from day one. Again, a no sugar, not necessarily restricted calories, obviously, but a no sugar, high fiber, and lots of walking diet right from day one should help. And I think the problem is a lot of people have an inherent tendency towards the acanthosis that gets flared up during the pregnancy because of the same insulin resistance. So that hereditary...
Somebody who's already pre-diabetic or maybe has a tendency towards diabetes in the family or maybe, obese.
Yes.
So in pregnancy, they have all the more chance to get acanthosis and insulin. Would you start the medications like metformin, or would you?
Only if they actually have diabetes, obviously. I generally don't initiate metformin in pregnancy till after the 7th or 8th month of pregnancy. If they're already on metformin, I tell them to continue it. But I don't initiate earlier stages of pregnancy, particularly very high sugars. Insulin remains the gold standard.
There's a question.
No, go ahead. Nothing related to this.
There's a question. Does hypothyroidism lead to Acanthosis nigricans? So, does thyroid really have a role? Like when we talk about co-hormones also elevating, like in PCOS, the other androgens elevating, does thyroid also have a role?
I'll tell you what an endocrinologist thinks, and then you can tell me what you as a dermatologist think. Any thyroid imbalance, again, like every other hormone in our body, will have an impact upon the skin, is my basic, very simplistic understanding.
Absolutely.
So I don't know whether it causes it, but I think it increases the tendency, and I think it will increase I know for sure it increases definitely yes, pigmentary changes do become more common when you develop a thyroid issue. Isn't that right, Dr. Parul? Or?
Yeah, I think so. Yes, of course. I mean, for us, even if it's hair fall or getting on, thyroid, asking for thyroid history is in our basic questionnaire.
Absolutely. Yeah.
Especially for women, definitely, yes.
There is one more question which we received yesterday on our Instagram, ma'am. Will bleaching in the salon help? Bleach of the neck, will it help?
Bleaching is a temporary method just to discolor and blend the upper layer of the skin and the hair. It's going to be temporary, definitely nowhere related to acanthosis treatment.
Right.
So, I mean, you can go ahead for other things, but it's not going to reduce the pigmentation at all.
Yeah. So let me check if there are more questions.
Doctor, do you also keep a check on the lipid profile repeatedly? I mean, do you also follow it up every 3 weeks?
If it's very normal to begin with, I don't repeat it. But if it was, you see a slightly high triglyceride, a slightly low HDL, I do repeat it. Just more from a motivational, and also to see that it will pick it up. You'll know that they've not been exercising if their triglycerides have gone up. So a bit of detective work we'll do like that.
Reverse detective work.
Yes.
And how about body mass index? So do we also do that, or do you kind of in the first session?
I just generally do like a weight actually. I think what is more important than a BMI is a waist circumference. Though, most of us, I don't, sometimes I have an inch tape, quite often I don't. But,
any particular range would you recommend for Indian women?
Indian women, what is recommended is less than 80 centimeters, 80. And for Indian men, 90. Yeah. That's like the cutoff for normal waist, which is like you have to be really thin to get that. But like I said,
Yeah.
I think that's important
Yeah.
to emphasize because, even a little bit of weight gain, again, like I said, around the tummy. So when we were doing a study on PCOS, what we found was even young girls as young as 18, 19, whose BMI was very low. They were only weighing like 60 kilos and their BMI was 22, 23, but they still had PCOS. And they were
Yeah.
insulin
Exactly.
resistant, and it was because of this little bit of weight around the tummy. Even that little bit of that 3 to 4 kilo gain, weight gain around the tummy, typically when they enter college or they start a job, that's another place where they gain weight. Leaving college, going into a job, that is when typically the PCOS, this insulin resistance, this whole thing flares up.
So how do you really justify? I mean, they're not much overweight. They are going to have a change of lifestyle. So how do we place such? I mean, these moderate or very minor changes in life. I mean, that's going to be with everybody.
Yes. So
So
I think what is important is to be, and it doesn't affect everybody the same way. Like a
yeah,
person, if you don't have the genetic hereditary tendency, that 3 to 4 kilos of weight gain may not cause the PCOS and the insulin resistance in person A, but can cause it in person B.
yeah,
And I think the way we keep talking about this, more awareness to know that
yeah,
prevention is best.
yeah,
It's never too early to start. Prevention is best. And to be aware that so many things in our lifestyle, in our surrounding environment impacts upon our health. We sort of tend to take it for granted. That at a younger age, I'm sure like Suman, has multiple nights where he goes without sleep. And
yeah.
he can handle it, at our age, my age, I can't handle it. But,
And
so,
at my age also.
but but the reason I'm mentioning it is, some people get frustrated because they feel they are doing everything right. They're exercising, they are, eating right. But unless you sort of take a more holistic approach and go a little bit deeper and say, also make sure that you're sleeping for the requisite number of hours and
Yeah,
sleep at the proper
exactly.
time, you may not be able to get, particularly for us as endocrinologists, all the hormonal imbalance don't really come back into another normal sort of balance unless we address multiple issues. So that's why it's important to be aware of it. We cannot say don't. It is going to happen. Like you say, natural life changes. It's all part of everybody's life. But
Part
at
of
least being
everything.
aware and taking some simple precautions from the beginning. I think awareness is the first step.
Yeah. So awareness, I think diet, health, exercise, sleep, I think we should also be focusing holistically on the health aspects nowadays rather than only going behind one particular career and then losing everything else in mind and
Absolutely.
waking up only when something like this happens or
Absolutely.
some kind of a disaster at 10 or 13 happens and then, coming to a doctor. I think that's a
Yes.
really good take home point. So just I know it's a very broad thing, but just a note on PCOS. So if somebody's got hyperandrogenism and you still do find that it's insulin resistance is there, so at that time already she's on a lot of medications, maybe for with OCPs and other anti-androgens. Would that time metformin also would be a good idea to add upon?
Yeah. So I don't, what can I say? I want to say I don't shy away from using metformin if I feel it's going to help with the insulin resistance. So
Hmm.
particularly for me, a good biomarker is the acanthosis. So
Yeah.
even if other blood reports are normal, if there is significant acanthosis, I would rather go with metformin and say periodic progesterone withdrawal and lifestyle changes rather than OCPs. I generally tend to use OCPs in PCOS.
Yeah.
I'm just talking about it. If they have significant acne or hirsutism,
Yeah.
only for that reason. So I don't use it particularly for irregular periods per se.
Hmm. Yeah. That's from an endocrinologist perspective. But if you send them to a gynec, then definitely OCPs is something which they will start. That's
Yeah.
their view of things. So probably they want the periods to be normalized first, getting the ovaries shrunken by the regular periods, getting the cells back and the follicles working normally, and then work on the other aspects of it.
But we'll have a discussion because I want to have a separate discussion on hirsutism, which is a huge problem
Yes.
faced by a lot of, our girls with PCOS, and as distressing, if not even more so than the acanthosis. So I'm
Yeah.
hoping, Dr. Parul, we can continue this.
Yes,
I
definitely.
think the
We will.
next series of this would be coming from one of the topic which we discussed. I think the next one would be that.
Excellent.
Yes, yes.
Thank you.
Why
Yes,
not? If
yes.
we can really create some ripples and waves of awareness into these kind of topics which have not been talked about too much and taken only as offbeat cases, but now they're really surfacing up. And it really, disheartens me to see young girls walking with so much of problem, and we really are unable to help them in all sort of ways. So counseling, probably, I would think we should look into. If we have somebody, get somebody ready, read about it, and talk in those terms, or maybe write up a questionnaire or something, or maybe so that we can pass it on. Okay, this is how it is. I think something more we should do more than the medicine. I think that would be a great idea.
I think that's a wonderful item. Yeah.
Ma'am, that exactly where this initiative, Hear Your Skin, this page we started some 1 month back before our webinar we had. So here we are only going to educate patients. The awareness is now much needed for this kind of conditions when it is related to insulin resistance. So there come the picture when a dermat and the endocrinologist are together, we are speaking. So the idea just started by talking to ma'am some 1 month back, and I just touched upon. So this idea was there with us, but we have not given it a shape. So last 1 month we have been there. Now we are getting started. So today is the first session. So going on, we'll have a lot of awareness videos, especially going forward to talk about all this about insulin resistance and how it is connected to skin. So name itself suggests hear your skin. So your skin speaks. So skin is the first organ which will tell you the mirror image of your internal organs. So there came the name hear your skin. So your skin speaks. So that's in the picture comes. So I think we got a question from Rahul. My all friends' skin is clear and my skin is dull. Why? Okay. My every
I'll
friend.
take it up separately, Rahul. I'll take that up. I think today we are just talking about acanthosis. Dull skin, we can take it up some other time.
Yeah.
On a dermat.
So
Any
I just want to say
messages? Yeah, Dr. Jayashree.
Sorry, no, I just want to say please join us again next week. Where we'll probably, I think next week we'll address hirsutism. I think we'll do hirsutism next week. I mean, I just, so please join. Sure. And I think.
You lost your voice, ma'am.
Sorry, hello? I just got a call.
Yeah.
Sorry. I'm back. The only one take-home message, like you say, is realize that acanthosis is a marker of a deeper underlying metabolic issue, and it is not just skin deep. I think that's the only thing I want to finish with.
Absolutely. And now that we are more aware and looking into acanthosis, the moment and whatever grade it comes to me, wherever I see it, I try to dig into, and I think Dr. Jayashree is all, the previous lectures I went through in past 2 days, your all thoughts about acanthosis, and the other metabolic thing. I think we are getting more aware about it. That's a great thing. We will also try to look into the right way, deeper into it. And whenever we need, we'll be calling you up.
Definitely. It's a pleasure. And then you can share the secret of how you keep your skin like this.
I will. I will. Thank you so much.
Thank you. Thanks, Suman. Thank you.
Thank you,
man.
Suresh,
for having us over. It was actually enlightening for dermatologists, of course. I think our practice will definitely, we will be looking more deeper into it.
Yes. Hello, ma'am, are you speaking, ma'am? I lost your voice, ma'am. Jayashree, ma'am. Hello. Ma'am, Dr. Jayashree, I think lost her voice.
Yeah, I think. Okay.
The connectivity issue might be there. So surely, ma'am, Curatio will be part of it, and this is just a start where this is the first session we are going into, and within 1 week we got a lot of questions. Even in the follow-up in the website, people came and there is just a small bot installed, asking only 2 questions. Do you have acanthosis? Yes or no? If yes, which are the parts affected? So yesterday we got 3 responses. So one is from Mumbai, one is from Hyderabad, one is from Kolhapur. So the people want to know how to get treated and how they want their solution. So together, I think we can create a awareness to help patients, especially when it comes to acanthosis and insulin resistance related diseases, when it comes hair loss or hirsutism or acne. Ma'am. So thank you. So next week again, we'll again come up with the next series of the program. So next we are going to talk about hirsutism and how it is related to insulin resistance and other comorbidities like PCOS. So thank you all. Thanks for joining. Thank you, ma'am.
Thank you so
Thank you,
much.
Dr. Jayashree.
Thank
you,
you,
Dr.
Dr.
Farooq.
Jayashree. Thank you so much. Thanks for having us over. Bye.
Welcome, ma'am. It's our pleasure. Bye,
I
ma'am.
see she can't hear.
Yeah.